35%, right? 34. And how many girls, how many boys? They are all of you are available. All of the students are available right now.
Except one doctor.
There are just 7 boys and also about probably the others are girls. Anyhow, I do understand. But, first of all, I want to suggest you actually increase your ability to talk in English. It's very important. You are students in a kind of international environment and international university, and you need some prerequisites to get better knowledge, understanding, and it makes your future better. First of all, you need it for your future, and next, you can use this ability for the other actually people who rely you. I'm talking about the patient who probably the people who are living in your society. You are occupational therapy students, so you may involve with some of the orthopedic disorder or courses for patients. So the course is very important. The course is designed to let you know how can you be, how can I say, you be familiar with some of the major problems in the orthopedic disorder, and how can you set a kind of plan for treatment. We are not talking about the occupational therapy treatment. I'm not an occupational therapist, but in this semester you are responsible to learn about the orthopedic disorder, and then probably you have another specific course under the title of, probably, I'm not sure, occupational therapy in orthopedic disorder or something, probably next semester or the semester after that. So you are free to record my voice, doesn't matter, it's okay. It's your chance to be in the class and learn. You are getting together to provide a kind of good environment for your learning. So it makes no difference for me. You are free to record my voice, or probably if you want, I'm not sure, record the classes on the video or something. It's going to be a good actual option because you can review the video on your free time. I hope that you have the kind of regular or authentic schedule for your daily basis program. So you consider a little time, probably half an hour or 1 hour per day, to review some of the courses you have it during the daytime. Okay, the class, every educational hour would be 45 something based on our content. But in a regular basis, in an official way, we have to consider at least every hour as a kind of 45 minutes and 15 minutes as a rest. So any class would be sometimes between 1.5 up to 1.45. And because of the schedule following a class toward another class, so you have to consider a short break between the classes and then come back to the class to continue. Okay, the chance that you have the video or voice record, it's very good because you can repeatedly check this information in your private time. And it's very good because you can repeat, for instance, a class just 10 times, 20 times, whatever you want. I know that probably some of you does have some limitation in English language, doesn't matter. Nobody, the English language is second language for me as well. It's not my mother tongue. But in any case, you have to, this is part of your responsibility to learn this ability. I mean, the professional language ability, since you need it for understanding. And without that, based on my experience in this university, mostly with the physio students, somehow with the older occupational therapy students, I know that many of the students here does have problem in English. So please do a start to learn it. There is no time too far, but you must start as soon as possible and just continue. It's not a one day actually job or 2 day job. Do not rely just to the English courses in the university. You can go for the private classes. I know there are some private classes during the through the Carvalho or somewhere else. And so it's a kind of necessity for you. You need it for further knowledge. I know some of you are good. Not sure because I'm not familiar with you. But the others that need or think that they need some kind of much better professionality, they can start as soon as possible. And at the same time, I'm suggesting that the students that they are good in English. Okay, there is no good at all, so you can be better and better and better. So go for it. Don't stop. I asked the physics students, what are you doing during your free time, leisure time? You know the meaning of leisure time, right? And they told me, mostly some of them, told me we are sleeping. So no need to sleep always. So you can do something better than sleep. Partially it can be some extra training for the language ability or something like that. And this is working for you, not for the Carvalho or Iraq. You need it to be a professional international person. Probably you are invited for another congress far from Iran, out in abroad. And so as a result, you need to provide a kind of conversation or networking, being in connection with the other professionals from the other part of the world, answer the question, share the knowledge, and you need these prerequisites. So be serious about that. Okay, at the time that my mother country was at the problem for something like war, when I'm saying we, actually there is a group of the professors, we couldn't come to Carvalho about probably 2 months or 1.5. It was designed for about the last times of the February. And I know that you have three sessions with another orthopedic surgeon, right? Yes. And when I saw the content that they provided to you, they would be, how can I say, they would be affordable, they would be useful. But because they were started probably with no alert, they didn't have enough experience for your course, occupational therapist course. And they didn't have any exact idea about the course curriculum. You know the meaning of course curriculum. They gave you and also the PTA students, gave you kind of mixture information. It was not designed in an appropriate way. But you can use these slides and information that they gave it to you, and not as a kind of, how can I say, just first session or second session or something like that. You can use them as a kind of accomplished information in different parts, because it's very important to know about the pathology or pathophysiology of the structure of orthopedic disorder. You know, most important orthopedic disorder refers to the structure of framework of the body, and this is bone, skeleton. We have to start with the skeleton physiopathology, and then so we are starting to review the orthopedic disorder just joint by joint. And this is a kind of organized model of teaching for you and orthopedic for occupational therapists. And also I have to consider, I'm not sure that the time is so short, but I have to consider that there is no chance, any other chance, you don't have any other chance to review some of the fractures. And so I extract the fractures from the physio course, because I will have time to bring the fractures next semester for them with the treatment of physio treatment for them. But there is no chance here for you. You have just one course of orthopedics, so I have to provide some of the fractures for you as well. Very simple one. We are not here to force you at all, but you must learn to get the knowledge gradually and in a good way. I'm not saying perfectly, because you are in initial spot, but you must learning very, how can I say, progressively or gradually, شوية in your word. But we must start. Okay, if you have any question or concern during the class, the time of the class, you are free to ask me whenever you have a question, you can raise your hand. And as far as I'm completing my words, I can refer to you and ask what is the question. And we have reviewed the contents that might be constant for you. So I don't think there is any other information that you needed for the future and this semester. If you don't have any question or concern, we can start to talk about the lovely orthopedic disorder. It's very nice. It's a very nice course. And you will learn it for sure. Any idea? Any point? No? If you are not getting or understanding the concept, you can ask me repeatedly. And if we have enough time, we can repeat the point for sure. Again, just review my words. I'm suggesting you consider a few times at the day of the teaching. Don't leave it for a while, 1 week later, 2 weeks later, because if you have a review on the day of teaching, you will keep in on your mind about 80% of the content. But if you leave it for 1 week later, 2 weeks later, probably you don't remember anything. So it's very important to review the content on the day of the teaching. It's scientific rules, in scientific rules. Have a look, or even whenever you're going back to the home or dormitory, so just turn it on, and probably you can try to cook something, eat something, just hear that. Just hear that. It helps you a lot. Any question? No? Okay, okey-doke. So, the references for your course is the first one, David Maggie, Orthopedic Physical Assessment. This is based on the course curriculum or references of the Ministry of Health and Medical Education in Iran. It's based on the American actually schedule. So, when you are looking to the year of publication, you must try to find the last version of the book. Don't just focus on this time. So whenever you see that David Maggie book is one of your reference, if you want to have better information or getting much distinct means very clear, very, in Arabic I think daqiq. Okay, very distinct information about this book or David Maggie. So you have to get the last edition. The last edition will be probably 2022 something. So don't focus on this time of the publication. So David Maggie is retired professor at the University of Alberta in Canada. And this book is one of the books for the PNE exam, national exam in Canada and also in US. And it's very huge book, more than 1,000 pages. And it's exactly designed for the assessment. I saw that the orthopedic surgeon provided some of the method of the assessment. I mean orthopedic test for you. I told you in the initial 3 sessions you have it with the orthopedic surgeon. It's full of the assessment, lots of the orthopedic tests that you can use it for a while, but it's not focused on different disorder or something like that. There are different disorders, different type of the orthopedic disorder is Kessler and Hertling, very famous, very famous. Voice is telling the Farsi word to the friend, and if he knows that, he can translate it to Arabic, because I have no idea about the Arabic language. I didn't have ability to talk in Arabic, so the only method of conversation is just English or probably Farsi, okay? Which is mother tongue, a little French as well. But you don't have ability to talk in French for sure. Huh?
Yes.
Okay, this is Farsi book. It's very nice book. It's very nice book. Probably a few of you can use it. You can leave it if you are not able to read the Farsi. And last one, Hoppenfeld. Hoppenfeld is a group of the family. All of them are orthopedic surgeons. A group of huge family. There are lots of books under the title of the Hoppenfeld. And so one of their book, you can use it as a kind of reference, treatment and rehabilitation of the fractures or orthopedic disorder. And so it's very good to provide some of the details for you. But you know, there are very heavy book, very lots of actually pages, full comprehensive book. I'm expecting that you are learning the words or the contents which I'm telling you. That is the slides, you can see that. And if you review the slides and at the same time hear the voices, you can be fluent in all of the information you needed for this course, okay? But in any case, if you want to prepare a textbook for yourself to refer sometimes, I'm suggesting you the first one is very good because it's including the whole of the, or majority of the orthopedic tests. You need it, you can use it. And also, if you have time, if you are interested, you can try to find or buy or rent from library and use them if you have time. Okay, first, what is the description of fracture and what is the description of the structure of the bone? You pass all of the anatomy, right?
Yes.
And also the physiology and pathology. Pathology?
No.
No. Do you have the pathology?
No.
Histology.
Histology is a part of the anatomy,
Yes.
but you don't have the pathology. Okay. So first and foremost, when you see a patient with a kind of problem in the bone, in skeletal body, so you must know what is happening if he does have, or she does have a kind of injury on the bone. The simplest type of injury for the bone is breaking the continuity of the normal anatomical situation. We call it fracture, right? Whatever, every time you are in doubt about my words, English words, you can search it. We are living in 2026. You can search it very simply with the online dictionary, English to Arabic, and find what is the meaning of the words which I'm using. Okay, so you can try for that, or later when you're watching the movie, you can try for that. No worry. On the time which I was continuing my education, we have to bring always a very heavy dictionary book with ourselves. You don't need it, just a cell phone can help you, okay? So any kind of disruption in the community, anatomical, normal anatomical position of the bone, we call it a break bone or disorder, orthopedic disorder for the bone. It's not just for the bone disorder, because the bone is a kind of framework that creates a kind of base for any kind of the movement. So you need the attachment of muscle and tendon to provide a kind of movement towards somewhere. So it's basement, I mean the framework of the bones. At the same time, attachment of the muscle, you learn lots of that on the anatomy or something. Okay, and is it fine? Is it enough? Not at all. Because the muscle must be under the control of nerve, and nerve is under the control of cortex, higher level of the nerve. And at the same time, you need a stability. You need a stability. So you need something to increase the stability, the stable situation of the joints. So you need something else. We call it ligament. At the same time, do we need any other things? Yes, for sure. We need cartilage because we want to absorb some level of the force from the bone, and at the same time, it helps us to move, to facilitate our movement. And finally, we may have some kind of skin problem when we have a kind of traumatology or orthopedic disorder, because before it breaks the bone, it injured or tear the skin. So when we are talking about orthopedic disorder, we are talking about all of the connective tissue. That means how many connective tissue does we have? I was telling you all of them. 7. Just bone, cartilage, okay? Muscle and tendon, ligament, nerve, skin. Okay? What about blood? A mixture of some of the tissue. What about the other tissue organ? For instance, stomach or something like that. There are something that they are all organs. It's not actually connective tissue. Good. So when you are talking about the orthopedic disorder, you are talking about all of the injuries of these 7 connective tissue. What is the meaning of connective tissue? You know that. What is that? That is a what?
In Arabic?
No, I can't understand Arabic. You are international in students. Speak İngilizce. İngilizce.
This help to stability, the skeleton of the body.
Move, stabilize all of the tissue in the body are connective tissue. So actually the method of treatment, method of the healing of all connective tissue are similar. But the difference is based on the characteristic of the tissue. That means if you have a specific cell to create new bone, you have another specific cell to create new muscle, or a specific cell to create, for instance, new tendon. They are working similarly, but because they are specialized for each connective tissue, they have different names. For bone is osteoblast, osteon is bone. For tendon is tenoblast, came from tendon. And for muscle is myoblast. Probably you read it in physiology or something. So, it shows that all of the cells, initial cells in the body, comes from initial source, main source. We have a very primitive. What is the meaning of primitive? Come on, you can check it in the dictionary. Fast. You cannot identify it through my face. Okay? Primitive. That means very, very old age, something like that. We call it, not old age is not good actually, translation. It's very initial. Do you know the meaning of initial? The problem is too primitive in initial. Initial means very,
Ancient?
not ancient, no. Probably in Arabic you say that أولية.
أفضلية.
أول.
Mhm.
Okay, it's very primitive.
أما ترجمة.
There is no specific situation. We have some kind of primitive cell. We call it MSC. That means, did you get the meaning in Arabic? No?
Yes.
Why? You are sitting, just have a look. I'm talking with all of you, not this lady. Actually, just be active in the class. Abaliye means abaliye. I think abal is similar in Arabic. Okay, we have lots of MSC. We call it mesenchymal stem cell. Mesenchymal stem cell. You have lots of Latin words. You must learn it. Some of them keep it on your mind. Doesn't matter, but you need it. Never ever in another part of the world you cannot use the Arabic or Farsi words at all. The science is Western science. This is not in our hand. You have to learn some of the words. Doesn't matter. It's okay. Just repeat it times by times, and you will keep it on your mind. So we have some benign initial abaliye, initial cell. We call it mesenchymal stem cell. They are able to be the specific cell to make new bone or muscle. Mesenchymal stem cell or muscle, myo, or tendon, or nerve. What should be? Neuro. Okay? There is another past term here when we are talking about the cells that creating some new tissue. We call it blast. Okay? There is osteo here for bone. It would be osteoblast. For muscle, myoblast. Tenoblast. Or for cartilage, what is that? Cartilage. What? Cartio. We have to hear, then keep it on your mind. You are right, but it's not cartio, it's chondroblast. Cartilage is tissue, just a little difference. Chondroblast. So we have in the ligament as well, we have in the skin as well. For skin is ischioblast. Have you heard that something? Do not invent something from yourself. You know what I mean? Do not invent. You must learn. Then you will be confident about the knowledge you got it, and then use it. Remember, for the skin it would be perfect. Fibroblast. So this is initial cell, who are initial specialized cell, who are responsible for initial tissue. Okay? So all of them does have a similar mother. So whenever you need new bone, you have to change the mesenchymal stem cell to osteoblast, or myoblast, or tenoblast. If you need the tendon, if you need the new nerve, okay, neuroblast. So that means the whole of the process would be under the control of a very wise mind or cortex. So we have some kind of peptide proteins, or another catalyzer, or another proteins to change it to osteoblast, change it to myoblast. So we don't have myoblast whenever we have a kind of fracture. We have some switching factor. This is very nice, authentic. Authentic means genuine, or authentic means daqiq. Very delicate, very delicate. When you need osteoblast in a fracture, okay, it would be changed to osteoblast. For the injury of the muscle, it would be changed to muscle. But the source, the origin is similar. Okay? And so, it's under the control of very delicate cortex control with a specific type of the proteins or catalyzers or kind of peptide or something like that. We have some specific item, we call it switching factor. Switching means key, okay? Switching factor that come to the area is like a is the key. Switching factor to open the door and help the initial cell, mesenchymal cell, benign cell, there's no specific, benign cell, to change it to very professional cell, osteoblast. Okay? So, just one more point in the first session. Myoblast or muscle and tendon are similar. Why? Because both of them led to provide a kind of contraction. They are contractile fiber. There is ability to contract, to provide a contraction, and labos, contraction for the muscle, right? And any other tissue you have ability of contraction in 7 types, 1, 2, 3, 4, 5, 6, 7. The last one is ligament, ligoblast. Okay, is there this one is contractile fiber, include contractile fiber, muscle. And tendon does have contractile fiber in the tendon as well. Okay, what about ligament? Is it contractile? You see any ligament that can provide a kind of contraction? No. Ligament is designed to provide stability. There is no chance for contraction. We call it non-contractile. But it's working to provide a kind of stability. We have lots of very famous ligaments all around the body. We are short review on them later. So, what about osteum? Is there any possibility for contraction? Not at all. Chondrome? No. Not at all. Neuron? No. Skin? Fibroblast? Very few. But it's not a kind of making energy. It's just a kind of contraction to move a little micro mechanism, micro material, something like that. It's not possible to use the skin for any kind of movement. It's not possible at all. Okay? There is a very few ability for the fibroblast. Okay, set. Everything is set. Any question? No?
What about the blood?
What?
What about the blood?
I told you there are mixture of some of the cells. It's not a pure connective tissue. Because the meaning of connective tissue, characteristic of the connective tissue, is not completely matched with the blood. It's including some monocyte, some T cells, T lymphocyte, and also some other materials such as hemoglobin, transfer oxygen, or something like that. And so you cannot adjust it as a kind of connective tissue. Connective tissue is that tissue. The blood is a kind of current, actually liquid. It's not tissue. Okay.
Doctor,
So anything else? Yes.
you mentioned before protein and the second one, what is it?
Switching factor, a key. Proteins, peptide, the different type of the proteins, catalyzer,
Yes, the catalyst.
and switching factor. This one is key, switching factor. Most of the chemical reactions lead to rich kind of professional differences of professional cells. It's under the control of, at last stage, switching factor, switching factor. Okay? So come back to the track. What does it mean? Back to the track. We're coming back to the main concept. This is a kind of English class as well. Okay. Okay. So when I'm telling you back to the track, I'm bringing you back to the main concept. Okay. So everything is set. Traumatic injury accounts for the majority of fracture. Clear? So don't think that I will write everything in the slides. It's not possible. You see, I'm talking probably more than 30 minutes, and we pass just two slides, just one slide or two slides. Just use the words, and continue the slides to identify the concept. Okay? If you want to see all of the words, you can read the books. It's different with the class, educational class. Okay? So, when we are talking about the bone healing process, this is important for us because we must know how the bone, a fracture, would be healed. This is the base concept of the orthopedic. Without that, we cannot actually further knowledge on the orthopedic disorder. We must know the process of the healing. We have 4 professional cells in bone healing process. Actually, in the bone, we have 4 professional specialized cells, including the osteoblast, you know that, osteoclast, osteocyte, bone lining cell. There are 4, okay? So, any of these cells does have a function, and any of these cells does have ancestor. What is the meaning of ancestor? Parents, father and mother. And any of these cells does have a destination, the final stage.
Yes.
So you must know the function, what is the parents, each one, and finally what is the destination of each one. Okay? So let's start with function. I was telling you about the function of osteoclasts. They are responsible for what?
For both the bone.
Initial bone formation, new bone tissue. Okay, new bone tissue. It's, imagine that you have a fracture and you have a kind of fixation, or you have a kind of healing process, or a neonate or a child neonate who was born just a few days and growing, being much stronger or thicker actually bone, growing initial bony tissue. Okay. Osteoclast. I have to show some picture, I think, to you. Osteoclast. Should I get the picture? Come on. If I have time, I have to change some of these slides. Come on. That one. So osteoblast, making new bone tissue. There are very small cuboid, you know the meaning of cuboid, rectangular, very small size with one nucleus. And at the same time, You have osteoclast. Osteoclast, a huge, big, giant ball, giant cell, more than 50 times bigger than one. So the size is not shown in this picture. 50 times, 50, more than bigger compared to that one. And multinucleus, osteoclast. What is the function of these cells?
For fighting cells is not good.
Oh,
يعني قتل الخلايا المتضررة أو شيء.
إنجليزي.
He translates.
She said.
No, you are responsible about your words. You are not you are not allowed actually to make him in trouble.
Yes. Call the cell is not in harm or good.
Or
Defense.
no. I will let you know.
Yes.
Don't worry. Don't make something from yourself. You know some knowledge. This is science. This is not imagination or philosophy or something else. So you cannot make it. You must know that, and then based on your knowledge, you can get a kind of deductional result. You have lots of information, deductional result. You reach the final stage. We call it deductional result. In Arabic, probably you call it istidrak. From the bigger information to exact amount of the result. Okay. So osteoclasts are responsible to remove some extra parcel. Okay. What does that mean? If you have a kind of fracture, you have lots of fragments, small fragments around. So, or bacteria, or dead cell, or clots, blood. You have to remove it till the tissue would be ready for the healing process. Okay? You have to remove it. So, osteoclast is a giant cell with a kind of bird at the end, like a Caribbean pirates. I'm not sure who is fan of the movie. Nobody? No. What are you doing in leisure time? Sleep? Same. Movie Caribbean Pirates. Actually, I think six, seven edition of Caribbean Pirates was made by a lovely actor Johnny Depp.
Yes.
This is the first time you have heard that. No, nobody knows Johnny Depp. Come on.
جاك سبارو محمد شاف فيلم جاك سبارو
اللي احتفظ بيه
معنا
It doesn't matter. Leave it. Come back to the track. Okay, you can find it through the YouTube or see it watching. You know, the cells does have some birds, and these birds help to provide some of the very strong acid sulfuric, and it helps to actually remove some of the extra parcel. And at the same time, I told you, bacteria, bone, small parcel, or probably the kind of dead cell, something like that. They are responsible to remove them. Why? Because you need a clean area. First, clean it, and then new bone are coming after that. So it's responsible, something like phagocyte, phagocyte, okay? And then they will be followed by the osteoclast. So we know the function. Then we have osteocyte. They are like a star cell. Star cell should lose their part of the cytoplasm, and just the arms are attached together, arms with the other osteoblasts. They are working as a brake or break based on the pronunciation, English pronunciation. What does that mean, the break? The part you are using for construction. Break. You know that?
Yes.
Brick. B-R-I-C-K. You can check it through the
Breaking
dictionary.
something.
You have dictionary, online dictionary. Use it, please. Break. Ajur in Farsi. Ajur in Farsi.
It's a lady.
Which kind of Farsi ability do you know? Okay. What is the tools you are using for construction? For the construction of building.
Yes, both of them.
Construction of building. Made a building, made a home. You are putting beton, materials, iron, and brick. Oh my God.
Bro? Breaking bad.
Did you find that?
Yes.
What is in Arabic?
Tabuk.
Tabuk.
Tabuk.
I can't understand what that means. Tabure?
Tabuk.
Tabuk, yes.
Yes.
Whatever you say, doesn't matter. I don't want to repeat it again. So, they are working as a bride. That means they are putting on the area that this is a new kind of the construction, boom, and getting more, and they are able to connect to each other to transfer, very important, transfer some of the message through the cytoplasmic R, the cells. Okay? And they're attaching to each other to reach the last one, bone lining cell. About 15 years ago, the researcher doesn't have any idea about the role of the bone lining cell, doesn't have any idea. But at the time, there is a very professional group in University of Western Ontario, Dr. Jeff Dixon, suggested that, okay, there is a very important role for bone lining cell they are sensitive against some of the environment stress and put the messages to the area that we need it inside of the bone. And this is very professional idea. There are some simple plate the cells like an island somewhere around the body of the bone. It's not located for whole of the bone lining cell. As I told you, the people believe that they are dead cells, they are not working. But about 15 years ago, the scientists believed that or identified that they are a kind of receptor. If they have a kind of normal stress, so they can order to increase number of osteoblasts or decrease number of osteoblasts if it's necessary. And the main source of the osteoblast is central canal of the bone, that is here. Central canal of the bone here. This is the main source of osteoprogenitor. This is the main source of the mesenchymal stem cell for bone. Main source for mesenchymal stem cell for bone. So we know the function of all of these cells, 4 cells. Okay, and what is the ancestor? What is the parents of this cell? The parents, which one is the first group of the cell that's going to be started to work after a fracture, after an injury? You are playing a soccer, oh, congratulate you, you are reaching the World Cup. The World Cup team was actually won, Bolivia. Imagine that there is a group of the soccer players in the middle of the game, got a kind of injury, and so what is the first initial physiologic response? Are you tired? I don't think so. It's very cozy. You know the meaning of cozy? Sweet. Cozy. Sweet course. And also professional promise. Okay. Okay. What are you saying to the concept? What is happening after, in first second after injury? What is happening? What?
Pain.
Before pain. Perfect. Perfect. In no doubt, you got the bleeding, the first stage. No doubt. So you may see bleeding in under your skin, or probably you may not see it because it's very micro bleeding under the skin. Okay, but in any case, with no doubt, from the first second you have bleeding. And if you have bleeding, you lose part of the blood. When you lose part of blood, you lose some part of the nutrients, okay? And at the same time, blood is responsible for oxygen. So you lose part of the oxygen as well. So that means you're confronting with hypoxia, decreased gradient of oxygen in the area. Decreased gradient oxygen of the area from the first second after injury. Lead to attract the monocyte in blood, somewhere else, okay? We call it hemodynamic monocyte. Why monocyte? That's because there's just one simple nucleus, okay? Monocyte. You read it in physiology, monocyte. Okay, attract the hemodynamic monocyte from different parts of the body, attract to the area of injury. The monocyte get together, make together, and make a new cell, huge cell at the area. We are talking about the bone biology. It's similar with other connective tissues, okay, but the name of the cell is different. And the stages, again, are similar, but it might be a little much comprehensive, much distinct, but the whole general idea is the same. All of them are connective tissue, okay? I will let you know much detail later. So they get together, the monocyte, hemodynamic monocyte, create osteoclast from initial second day up to the 1 or 2 day. You have lots of osteoclasts there in the area of the fracture. They are starting to work to eat some of the parcels, some of the dead cells, blood clots, because you have a bleeding, there is a clot there. So they eat the clots and they make the area clean. How long it can be elongate makes no difference, but this is the time that the initial time of the fractures. This is the time sometimes about 2, 3, 4, at most 5 days. And at the same time, when we have a kind of initial clean at the area, we need something that bring the osteum, bring the initial tissue of the bone, osteoblast. Okay, that means we have started to clean the area. After 1, 2 days, it's not possible, it's not correct that wait up to the time that first group is working and then second group come after that. They have a kind of overlap. It started with osteoclast formation, but after 2 days, osteoblast is formed as well, and they're coming after the osteoclast. So they're gradually going up. Okay, the father and mother, parents of these cells are hemodynamic, monocyte, in capillary, and they are working, clean the area, such a kind of, we call it, what's that? Yeah, something like that. And they were followed by osteoblast. Where is the source of the osteoblast? I told you, the main source of the osteoblast is mesenchymal stem cell here in the main canal, central canal of the bone. Mesenchymal stem, you do remember mesenchymal stem cell. The very important problem for the students, Iraqi students, I do believe. There is no memory. You hear the words, but don't keep it on your mind. Just leave it very soon. I'm talking general. This is based on my experience after 2.5 or 3 years teaching in Saturday. But I could change some of the memory problems for some group of the students. Lovely when I'm watching these guys or ladies can explain something in the older actually grades. So it makes me so happy. So just be curious, just be alert about the words you hear that. No worry, just repeat it. Keep it on your mind. Don't lose it. Probably I will ask you tomorrow, what is osteoblast? Nobody doesn't have any idea what is osteoblast. Just try to repeat it on your mind. Just try to repeat. It's a mistake, it's a problem. And I do believe you changed your country, for sure. Because probably you are the first group of the professional people who are evolving or growing in a kind of scientific way, as far as I know. I'm pretty confident that you can be perfect for this country, but you must be curious about your situation and your progression must go on. If you're going home and asleep, it does not happen. Okay, I'm not talking about all of you, but majority of you, I think, they can actually move this process and reach a good situation. And you're helpful for the country. So the main source of the osteoblast is mesenchymal stem cell. What was the mesenchymal stem cell? Benign cell. I told you here, MSC, benign cell who can change to different type of the professional cells. Do you remember mesenchymal stem cell?
Yes.
Give me 2 cents. Do you remember? Come on. Mesenchymal stem cell, benign cell, initial cell. I drew the
Yes.
cell for you. Okay. Okay. There are lots of mesenchymal stem cells here. Under the control of necessity, a message, they are changing to be osteoblasts. So the main source of the osteoblast is central canal, or we call it red marrow. Marrow is brain something, red marrow. Central canal is another name, red marrow. There are 2 other sources. I will tell you later. I don't want to make you confused. But the main source is about 85–90% of the osteoblasts are coming from here, central canal. So if you have a kind of destruction inside of the central canal, what will happen? You will lose main source of the osteoblast. And if you don't have enough osteoblasts, there is no healing. You are completely tattooed. Okay? So you must be confident about the healthy situation of central canal. And 80–90% refers to that one. So the parents of this one is 3 sources. First and most important one is central canal. The other 2, about 10%, I will let you know. Whatever, they are starting to secrete some of the initial bone tissue, bony tissue, just like a kind of gum, chewing gum. Like a gum that is very loose, that there is no structural gum, it's not hard, it's very loose. The bony tissue that they are producing, they are secreting, is a kind of gum, very loose gum. And it cannot, the tissue is not very strong, it's not very resistant. We need something like a kind of home. We need something to make it strong. Use iron inside, iron bar inside, or provide some kind of beton for the construction. We need to provide some changes in tissue, but the initial tissue is very loose tissue. We call it osteoid. Its name doesn't important. Osteoid instead of bone, and it's exactly like a losing gum. As far as you can actually change the physics of the gum easily, right? It's very loose tissue. Okay, this is the first initial tissue. They secreting in the area, and as far as they are cleaning, they are secreting the tissue, and the tissue, the new tissue, gradually get around of these cells, make them entrap. They are secreting, and the secretion come to the area and get the cells trapped. And what is happening? They make them to the inside of the bone tissue. They lose their cytoplasm and get a kind of cytoplasmic arm, get together. They change to osteocyte. They would be, the osteoblast would be bright. What did you say? The bright of the construction on the body shaft of the bone. And as far as they are growing through the ages, because we have a kind of physiologic process, I will let you know later, they are growing reach to the superficial, much superficial actually, cells, which is the last wire connect to the superficial area of the bone, gradually going out. Part of them get together, create kind of island, we call it bone lining cell. So the father and mother of the osteocyte is osteoblast, and trap osteoblast, and they will be growing, they will be moving a little up to reach to the superficial area of the bone, and they change to bone lining cell. Again, they lose part of the cytoplasm, would be a little rectangular and sit together for a specific part of the bone. So we know the function. They were stimulated, transfer the stimulation through the osteocyte, probably tell here is central canal. Tell the central canal, okay, we need much osteoblast. We need much bone. They are working to provide much osteoblast, come to the area, create much new bone, okay? Or they may say that, okay, we don't have, we do have, bone, new bone. So make the speed of bone regeneration a little lower. Decrease the speed of the osteoblast. So they will send a kind of message to decrease the speed of the osteoblast, making osteoblast. Okay, so you know the source of that one, the source of the osteoblast, and the story. So what is happening, the destination? We talk about all parents. You know all of the parents right now. Parents of that one is osteoblast, this one is osteocyte. So what is happening in the last for them? So we can start from the osteoclast. After a few days, you know in initial spot of the healing process, we have inflammation stages. We'll be following with modeling, which we do have new generation of tissue, not a structural, just like a chewing gum. And then remodeling after a while, which is a kind of a structural. So a loose tissue, such a kind of gum, cannot be effective to tolerate all of the forces. We need a very strong tissue here. So we need something specific. We need to make the tissue strong. We need exactly like the construction in normal home, normal building. So the brick is not enough. You have to consider iron rod, or steel rod, at the same time beton, cement, to keep together all together. So we have modeling with brick and remodeling. That means make a super professional or well-organized structure. That is good for the body. That is the real skeleton. This is a process. So we call it inflammation or acute stage, initial part, then modeling, then remodeling. Modeling new tissue, remodeling structural tissue. Modeling, there's another name, just learn the name. Don't forget it, remember it. Say that with yourself. Modeling or palliative. parative, P-A-R-A-T-I-V-E, parative, there's a name. Or remodeling or reparative, another name, just name. Okay, so what is happening? The destination, after they did, which stages they are working? Just inflammation, right? Correct. Just inflammation, because they are responsible to make it clean, make it ready for the initial tissue, right? So, in inflammation, they gone after 5-6 days, because the period of inflammation is something between 2 to 5 days or 6 days, okay? After inflammation, what's happening for them? Apoptosis. Apoptosis. A-P-O-P-tosis. That means kind of suicide for the cell. The cell suicide itself. They actually explode the cell. And the whole of the materials, element, calcium, phosphate, lysosome, anything here inside would be spreading. And under the situation of retraction, under the situation of getting out, they will be retracted by the blood and getting out. Okay, so they will be apoptosis. What about that one? They will be in destination, they will be in trap and change to osteocyte. This is the destination of osteoblast. The osteocyte is going to mostly come to the surface area and change to bone lining cell. What's happening in bone lining cell? They will still available. You can see bone lining cell, the skeleton of a mummy from Egypt, or a skeleton belongs to 6,000 years ago. Still, you can identify that bone lining cell. They are not active, but you can see the bone lining cell on there. They will be available. Okay, so just one more point. So you have a kind of inflammation, and then you reach the modeling stage. Inflammation, then you reach to modeling stage, secretion of that one. So you don't need the formation of osteoblast anymore. And so you are making better situation, but after 10 days, after 2 weeks, the patient go for somewhere and get a kind of another injury at the area, or do another bad movement, or wants to close the door and get a kind of trauma on their hand. So it's not healed yet. But what is happening? Tissue is in modeling stage. And so everything can be returned to the inflammation. You cannot miss it. If you have another re-injury, so you are returning to the first spot. Okay, can we, because we are in hurry, we are going to be healed very soon, okay? So can we jump from one stage from inflammation to remodeling? Not at all. It's not possible. We can do something, but it's not possible to remove a stage. So whenever you're returning to inflammation, everything will be start from the first. So on, step by step. Okay, and so if you repeatedly do that, so the risk of non-union or delayed union when you arise, after 3 times, 4 times, you may confront with a kind of non-union, delay union. If you are not starting the initial spot of the healing, this process, for initial 3 months, you are confronting with delayed union, the union postponed, delayed union. I'm talking about the bone, okay? And if the healing process of union process, bone healing, bone fracture process, would be delayed more than 9 months, it would be non-union. So we have to do something to provide the union. So up to 3 months, delay union, and after 9 months, non-union. Clear?
Just the last part.
The last part.
Yes.
If you can't see any kind of healing process up to 3 months, okay, so it's delay union with ta'khir.
Yes.
And if you can't see any healing process up to 9 months, it's non-union. There is no chance of union. It's la union. Khalas. Okay? So some folks believe that you can wait up to 6 months instead of 3 months. It depends to the classification, doesn't matter. Okay. So everything we talk about the cells, you are so knowledgeable right now about the bones. Just one more tissue, one more point, and I think it's enough. You can have a rest. One more point. So, in a normal basis, in normal physiology, physiopathology, we have the osteoclast moving a little forward, and then they are followed with the osteoblast making new tissue, and then they are following with what we need after the initial bone. What we needed? Food, oxygen. What does that mean? We need
Nutrition.
blood. We need blood. Okay? We need new blood, new artery, new vein or something, lymph vessel. That, and how can there is a term for that one? New micro vessel, new micro artery, new micro vein. Whenever you have this kind of new micro vessel is a kind of plural name for artery and vein, both of them. When you have a new micro vessel, you call it, this process, you call it angiogenesis. Angiogenesis, A-N-G, angio, I-O, let me write, angiogenesis. Angiogenesis. What does that mean? Making new vessel, artery, vein, new vessel. So we have osteoclast coming forward, then osteoblast coming after that, then new vessel, angiogenesis. That means a kind of what? Osteoblast, multiple nucleus. Okay? Osteoblast. They're coming with a small covoid, osteoblast, right? And coming with new artery. So what does it look like? It's kind of pyramid. Ahram Salah said. It's a kind of pyramid. And so, cone, we call it cone. I'm not sure actually you know the meaning of cone in Farsi. You can translate it to the others. You know the sugar, the small, the solid type of the sugar and solid sugar is a kind of cone. It's exactly like a cone. You can break it to the small parts of the hand you use. Okay. Cone, that one. Akhrut. The whole of the concept, you must hear that in physiology. Because it's part of the physiology, you must learn it. You call this complex, you call it cutting cone. You call this process cutting cone. مخروط. Cutting cone. It's movable around the fracture site. Any question you may have?
We just take neurophysiology. The
Take
other
what?
neurophysiology, just in our course.
Yeah.
Neurophysiology.
Physiology. What about the other physiology?
We didn't take.
No.
So what should I say right now?
No, you thought we have the osteology, the full course.
Probably you are covering it somewhere else. I'm not sure. No, neurophysiology. You don't have the general physiology. Neurophysiology is something specific. With Dr.
Yes.
Shafi, I think.
شايفين عند بقى.
Okay, it's something different. You have, do you have any kind of general physiology?
General physiology.
Guyton, Gannon?
No. General physiology, you take that just the respiratory, cardio and muscle, just. بالمرحلة الأولى.
So I'm not sure. You can check the curriculum, but anyhow, this is part of the physiology. You need it probably. It's based on the course curriculum. I'm not sure. Cutting cone is the physiology of the bone, and so anyhow, you learn it right now. Okay. Any question?
No.
Nothing. You feel better right now.
Yes, yes.
Okay, we have time
يقول
for a short rest, and let's.